Hello, my name is Nico Yeager, and I'm a doctoral student at University of Massachusetts Global, and I'm going to be doing a video project proposal regarding a medical health application called My Action Planner and the possibility of using it in a family practice setting. I had the question, could improved life balance be achieved using an mHealth application and self-direction with patients, specifically looking at sleep combined with exercise and relaxation and a balanced diet in impacting the overall health of patients. What do we know about sleep and exercise is that the Centers for Disease Control have linked chronic health conditions specifically to poor quality of sleep since 1984, that they work with the Academy of Sleep Medicine and National Association of Chronic Disease Disorders to mitigate the health risks that come with poor sleep quality, that patients who don't sleep well are less likely to exercise or eat healthy, sometimes because they require elevated dopamine and they're seeking it through eating sugary foods, or they have the lack of energy to pursue healthy cooking or exercise. We also know that poor nutrition and lack of exercise is directly related to comorbidities and early patient death, and that the CDC has a sleep and sleep disorder behavioral risk factor surveillance team that's the largest in the world, and that they're working with other countries to bring research and relationship to these access and information and chronic disease awareness. Looking at the CDC, 2014 was the latest that I could find with regard to sleep and the number of hours people are reporting in adults. For those that are getting less than 7 hours, it varies from state to state between 28.5% and 44.1%, with shift work, mental health issues like anxiety and depression, alcohol and drug use, obesity, hormonal changes through aging, smoking, chronic pain, restless leg syndrome, and complex sleep disorders like sleepwalking as some of the contributing factors. The CDC also discussed associated chronic health issues related to lack of sleep as increase in chronic pain, diabetes worsening, stroke, cardiovascular disease, depression and anxiety, obesity, driving, and distraction from accidents on the road, from fatigue and sleep deprivation. We know that we recommend sleep quality improvement through sleep hygiene, which is retraining of the brain and helping it learn cues that it's time to go to sleep, avoiding eating 3 hours before bedtime, using a CPAP if they have obstructive sleep apnea, treatment of restless leg syndrome, exercise and meditation, avoiding caffeine and alcohol, avoiding electronics 1 to 2 hours before bed, treating the mental health disorders, and avoiding dependency of medications like benzos or over-the-counter sleep medications. Now, I also wanted to discuss whether or not using sleep and exercise could improve sleep quality and weight. And I went through several reputable medical search bases and found that there were multiple studies that said regular exercise benefits both sleep and mental health and weight if they engaged in at least 30 minutes of exercise on a daily basis. And many of them used polysomnography to determine how deeply they went into REM sleep also. But in particular, there were studies that supported using things like Tai Chi, yoga, Qigong, Bagua, aerobic exercise, obviously, but water therapy and resistance exercise in a chair also helped with sleep and weight, and that we should be measuring sleep quality through a good indicator tool like the Pittsburgh Quality Sleep Index, but you can also use those tools when people are associating meditative exercise rather than just sleep quality itself. Now, the third part of this triad, because this is what the mHealth application focuses on, it focuses on sleep, exercise, and diet. Does diet have long-term impact on chronic health issues? We know that it does, again, through many studies and through CDC reporting. We also gauge adults as having a healthy BMI if it's between 18 and 24.9. But there are patients that can have chronic health issues despite having a normal BMI. So don't let a normal BMI fool you into thinking that they have poor eating habits or they don't have poor quality sleep. We know that, again, sleep quality and exercise are impacted by poor diet, so the better the diet, the better the sleep quality. I try not to suggest anything that's too big of a change for patients to apply to their life. It is a lifetime exercise, so I start with moderation. I talk about lean protein, high fiber, low carbohydrate, low sugar to help with sleep and with exercise and weight moderation. But if they have a medical contraindication that requires a very specific diet, perhaps like a patient who's on dialysis, then that would need to be taken into account and something tailored specifically for them. But I think it's important to understand that mental health trauma can play a big role in a person's ability or even their initiative to follow any program, whether it's for sleep improvement, exercise, or any other change in their lifestyle. In particular, people who have childhood mental health trauma, where the ventral striatal part of the brain is affected, that's where the dopamine craving comes in, and they sometimes lead to adulthood obesity because they're seeking the dopamine release from eating high sugar, high fat foods. Are there social, ethical, and financial issues to take into consider? There are. The CDC says that 90% of healthcare costs in the US are related to chronic medical and mental health issues, and the top ones being cardiac, obesity, diabetes, mental health. Those ones themselves, in between 2019 and 2020, amounted to over $1.1 trillion. And then the social ethical considerations regarding treating sleep issues, obesity, or mental health, and chronic health issues is the first one is, does the patient have a safe place to exercise or access to safe place exercise? Maybe they don't live in a safe neighborhood. Maybe there are no local gyms. Maybe they can't afford it to go to a local gym. We also need to understand that we have to treat those comorbid health issues at the same time. We can't focus on one and not the others. They are all interlinked. That patients who have morbid obesity or who are heavy often have poor self-esteem and don't feel comfortable exercising or going out in public to exercise because, to be honest, public perception is very negative toward people who are overweight. And so, rightly so, they have some reasons to be fearful or to avoid wanting to do that, and we have to take that into consideration. We also have to take into consideration their financial ability to pay for services related to weight loss, treatment, mental health treatment services, and that realistically there still is income, gender, and ethnicity bias even in medical care. And we want to make sure we address those issues if possible for our patients so that they feel comfortable seeking treatment. My project really, I wanted to see if via self-reporting, can patients feel better with regular sleep cycle, have a more improved immune response, if they have better physical health or weight loss related to exercise, if they incorporated importance of mental health, meditation, relaxation into their lifestyle via self-reporting. But also help them understand that regular follow-up with their primary care to discuss the results, achieve insight, maybe adjust their plan a little bit if something isn't working, could be helpful. And that it could help reduce health disparity and provide equity and access through free healthcare application and allow patients less stigma and freedom to improve themselves on their own schedule. The application, my action planner, the pictures that were brought in, this first one on this side is how the patient sets up a plan. They pick the day, they pick the category like exercise or relaxation or other. They type in specifically what they want to do, how often they want to do it, but it also asks them how confident they are, which I'm not sure that you can see it because of the recording, but it asks for a confidence level between 1 and 10. Here's a copy of someone's plans: read a book, avoid sugary drinks, take a walk. There is an update a progress section where you can update it. And then it also has a chart section where it can tell you how often you're meeting your goals. So in 50% of the time, they were completely meeting their goals, but in 17% of the time, they were not. As the DMP student, I also used this result. I chose the two areas that I really struggle with, which is relaxation and exercise. Just being a busy provider and being a busy student, a lot of my time is taken up. So I put in a 30-day goal of walking daily for 30 minutes and for meditating for 30 minutes a day. My confidence level that I set for walking daily was 5 out of 10. It's not my most favorite activity to do. And my confidence level for meditation was 7 out of 10 because I wasn't sure I would always have time to do it given my busy schedule. I found out that in 30 days, because I was monitoring myself, and probably because I was also doing this project, I was able to see that I completed those goals 100% of the time, self-reporting, despite my low confidence level in physical activity in particular. Who were the collaborators on my proposal? I spoke with a medical director outside of myself to see if it was something that he would be open to incorporating into his family practice, a licensed clinical therapist to make sure that I was meeting the mental health needs appropriately of some of our patients who might be dealing with a lot of trauma, an exercise physiologist who worked in cardiopulmonary rehab to help me understand the specific needs of the very medically frail and how to start them off and guide them on, working slowly at the beginning. A registered nurse who has over 25 years in the emergency room, whose focus in particular for him was continuity of care. He was a very strong advocate of starting education early and would even ask questions to patients in the ER of, do you use applications on your phone to, keep track of your medications or your lifestyle? And really feels like it's something that should be brought up in the beginning, talked to throughout their hospital stay, and also followed up on the outpatient level with the providers. And then also a back office personnel who really wanted to be involved in the education and the support of the patients, and felt like that they had the opportunity to spend more time with them than maybe the provider would have outside of the regular visit. The ideas that came from my collaborators were to create a tip list on how to download and use the application in both English and Spanish, to use a back office personnel to provide additional education, especially our elderly ones who may require more time, teach the patients how to screenshot and email their results to the office so that they could be uploaded into the charts and kept for continuity of care to look back over time. Incorporate diet, exercise, meditation, and sleep tips into the follow-up appointments so it doesn't always have to be done at the beginning. To utilize the extra billing time if extra time is needed to teach for our Medicare patients so that we get reimbursed appropriately on the provider level. Bring in nutritionists, therapists, or sleep studies or referrals to other places to treat underlying issues, treat addiction issues, and to provide gender preference or safe spaces or ethnic specific providers if a patient has a preference and would like that. Why do I think it's innovative? I think that it's because the patient is the captain of their ship, the driver of the boat of their health, and that when they learn how goal setting is done and they continue to increase their goals over time, they can mediate and mitigate what works for them and what doesn't work for them. And if they can be encouraged to build on those areas of health and they find benefit to it, they'll be more bought in to taking care of themselves. It allows them to set realistic goals that they could reach easy at the beginning and then work on more complex ones over time. They can create very specific ones, such as, take blood pressure medication in morning, or, talk to my therapist twice a week, whatever they need to do to incorporate whatever level of health is required for them that's specific to meeting whatever goal they feel is important. It also reinforces goal achievement through positive reinforcement. They have both the provider being able to reinforce them, the people in their lives being able to reinforce them because they can show them what they're doing on their app and share how well they're doing, but they can also look at it at any time and get that reinforcement. If they start to falter and say, I really don't want to do this today, they go, but look, I've done it for the last 30 days. I don't want to quit now. It's also fee-free and portable. The patient doesn't necessarily need to see a specialist. They can do it at any time, in any area, and address any specific intervention that they feel is needed. And they could use their time with their provider more effectively in the long run. These are my references. I hope I've provided you with some insight on my health tracker planner, and I hope that you'll be able to incorporate it into